Susan Mazer, Dallas Smith, thanks so much. Wow, that was fantastic. So, aside from comforting us in a moment of pretty high emotional energy there, we've asked you here to talk about just the remarkable success that you've had using your music to transform the healthcare experience. Tell us a little bit about the Care Channel and the Care Network that you developed.
Well, we both have had full-time performing careers for about 25 years, and our backgrounds were classical, and then we crossed over to the dark side of jazz.
It's working for me.
Yeah, right.
Side, yeah.
And then we both decided, and we already had met after we had our careers separately, and somehow being brilliant and having success wasn't enough. We had to do something else, and I had begun working with nurses in about 1981 at the request of an organization in San Jose, California, and Dallas had begun playing with a musicologist and composer, Stephen Halpern, and we met on a record label, Rising Sun Records, and it was through the request of the hospitals that we began working with that they asked us to provide music for patients. And at the time, this was in the late 80s, the only available, the most obvious technology was Walkman. For those of you who are old enough to remember Walkman. And the Walkman would walk. You know, the hospital would try to provide them, and tapes were clumsy. And so we decided that the most obvious technology in every room was the television. So we looked at providing music on the television, and then of course we had the television screen to deal with. So Dallas became a video producer. And that was 1992 is when we got our first hospital. And now we're in over 700 hospitals. And it's a 24-hour evidence-based relaxation program that really looks at creating a biophilic environment, an environment that really uses nature to comfort the innate part of us that is so universally attracted to all living things, and as well uses instrumental music now, not of just Dallas and I, but of 50 other composer artists who've contributed their music to the Care Channel.
Let's explore a little bit of the design question here, and I may try to get you to demonstrate, because I'm such a radio geek guy. I mean, I know you guys are fabulous enough musicians that you could probably either tell me to go away or go with me. But this is something much more sophisticated than just generic kind of spa music. We're not talking about either nostalgia or just chill people out. We're talking about something, and you said evidence-based.
That's right.
I wish you'd explore that a little bit for us.
Can you talk about that?
Yeah.
I can say a few words about that. Let me just start by saying we trust that you had never heard that piece of music before that you heard. And this is an approach that we take in programming music for the healthcare setting, that we choose unfamiliar music. If we had played a piece that you had heard before, you would have been taken to the past, to your experience of that piece, perhaps comparing with what you heard before or a memory of that time. And we wanted to choose unfamiliar music to have you in the present or looking to the future, first of all. Then we know...
Can we explore that for just a second?
Sure.
Is there something, I mean, I remember when my mother was in the intensive care unit here at Mayo Clinic and was in a coma, and we brought her favorite music, and I can't remember what it was at the time, but there was some talk of this nostalgia thing maybe sometimes getting in the way of moving forward on care. How have you seen that to be the case?
Well, we're not saying that there's no place for a patient's familiar music and what they love, particularly in older patients where music can create engagement, can aid in being able to socialize and otherwise to relieve pain, to help in rest, and
There's
so
a place for it.
There's a place
Yeah,
for it.
yeah.
But our challenge was choosing music that was going to cross over barriers of age, ethnicity, economics, educational level, all of those things that comprise the audience, which consists of patients, families, caregivers, staff, visitors, everyone in the healthcare setting. So that's how we differentiate that choice of music from the usual commercial choices where the public is divided into different groups and music is chosen specifically for that particular age or musical taste.
Since,
Yeah, can I add?
Go ahead, yeah, please.
Let me add to that. Nostalgia is very much related to depression. And it needs to be used very carefully. And I say that because it's one thing to play someone's very familiar music to pull them back into their life, if they're in a coma or they have a degree of dementia, something that they can connect to. It's another thing to try and create a very empowered present moment where they won't be pulled back into a life they can no longer have. So I think that that's, and the other piece of that is that unfamiliar music doesn't mean that it won't sound familiar. That we use music that has form and structure and rhythm and melody. It's just not going to be the melody that you got married to, divorced to, married again to, divorced again to. You know, it's not going to be something that hooks you into a part of your life that may or may not be optimal to be revisited at that time.
well, since we've been describing that healthcare is culture and there's a cultural component to every aspect of healthcare, I would suspect the patient population would have a different interest. That you could replicate this unfamiliarity, but you'd have to do it in different styles for different kind of patient groups. How has that worked?
No, we have not had to do that.
Really?
No. The Care Channel is provided in children's hospitals, in Alzheimer's units, in long-term care facilities, in acute care, in rehab facilities, and there's a universality about the musical moment.
Is it a jazz language? Is it a...
It's a cross between, okay, let's look, if I asked you, what does country and western, jazz, progressive jazz, and Mozart have in common? It would be all tonic dominant harmony. The 1 chord, the 4 chord, the 5 chord, the 1 chord, and everything they stick in between.
You'll have to demonstrate.
You want me to demonstrate?
1 4 5. Do us a 1 4 5.
Okay, I'll do a 1 4 5.
Do us a 1 4 5.
Okay. 1 4. Oops. Where are my pedals? Yeah. 1. Everybody uses the 1 4 5 chord. Now, if I want to go into jazz, I could go. It's still 1 4 5. So when you look at
Jay-Z in 1 4 5.
well, it's very interesting that when we look at the syntax of music, you can hear, like the piece we played, I wrote, and it did use 1 4 5, but not in that order. But you could listen to it, and you weren't affronted by it. So if I played music that was from another culture, Dallas, why don't you play a raga?
I just want to augment what you're saying by saying that we can talk about different styles and the different elements, and if this encourages the patient to bring their own music or the family to bring in the patient's preferred music, then we are all for that. But we are taking more, I guess, the larger view of the environment of care and seeing the sound environment as a neglected aspect of patient care design, and music can certainly treat that environment, music as environmental design.
So this baseline design of sound in the care experience becomes an entry point for the family to maybe move in and bring
Absolutely,
their
for
records
patient
from home, and bring
engagement,
their
for
books.
family engagement. At the same time, the music might be masking the sounds of the beepers, buzzers, alarms, rolling carts, conversations, slamming doors, all of those things.
Thank God for that.
Right, so
Yes.
there are other benefits besides just music for music's sake. And our basic criteria is it should be good music, pleasing music. It can serve as background or foreground. It can mask those noises and create a conducive environment for rest, relaxation, the intention of the healer. It extends the intention, the healing intention of the nurse and the doctor. The
And how many
caregiver.
facilities? 700?
Over 700.
Over 700.
Now, do you compose together?
We do?
Yep.
And we're still married.
And you're still, that's great.
Yeah.
I mean, you know, since what you're trying to do is come up with stuff that's unfamiliar, I suspect your collaborative relationship is kind of like, no, that sounds too much like Johnny Mercer, or no, you're ripping off another song again.
Right. Well, it's not that we're trying to be unfamiliar. We're saying that when we try to be original, then it will be naturally unfamiliar until you become familiar with it, and then let's compose some new music. And,
All right. Well,
when the normal patient stay is relatively short, they do not hear the same music again because we have a large library that...
Yeah, and I'd like to add that there isn't anything familiar about being a patient. There isn't anything, a patient goes into a hospital, and I was recently a patient for 10 days in a hospital in Las Vegas, and without question, the most painful part of the 10 days was when I was well enough to be truly and authentically miserable. And the clock just did not move fast enough. It just, you know, there's earth time, clock time, and then there's lived time. And music mitigates that. You know, that's why we listen to it. It changes our perception of time and place, and
It helps
so
the
when
time
you're
to
looking
pass.
at the patient experience, which is now kind of in the forefront, trying not to again be patient satisfaction, but when you're looking at that, you have to look at the lived experience, not even just the perceived experience. And so for the hospital to add at least something where the patient knows, the hospital knows I'm in the room 24 hours a day, they come in and out, but I'm here. And there's only so much commercial television
yes.
that'll work.
We
and
all
most of
discovered
it,
those limits
right.
in the hospital, that's for sure.
So,
Well, Susan and Dallas, thanks so much.
thank you.
Susan Mazer and Dallas Smith.
Thank you.
Thank you.